If I hadn't seen the community link worker, I don't actually know if I'd still be here, to be honest, because the self-harming was at an all-time low. I was doing it quite regular, which my self-harming is taking extra pills. Not to end my life, but instead of cutting myself, I take pills. And not having the support before, all I had was the crisis team. And I just felt like dumped by the system, that I wasn't bad enough.
There's an old saying that says, home is for health, but hospital is for repairs. And actually what happens widely in our life in terms of where we live, we've got good housing, is our family okay, have we got a job, have we got good social connections? All of those things really play into our health and well-being. And without them, then actually often some of the symptoms of physical ill health can start to manifest.
Nationally, the figures around patients attending consultations for non-medically related problems is 1 in 5 patients. Every 10 minutes with the GP costs £36. However, an average non-medical appointment will often take longer, possibly 20 minutes at £78. At just one of our practices, this would amount to 157 patients per week, 52 hours per week, and a cost of £12,246 per week. In the East locality, across our 4 practices, in the last 12 months we've actually referred 714 of these patients to see our community link workers.
So as community link workers, we're employed by Edberts House, but we actually sit as part of the GP practice team. I think that's really important because it enables patients to trust us. Patients know that we're part of the practice team. It allows us to build good relationships with the clinical staff, but also the admin staff, so that we can all be working together really well.
When they referred me to the link worker, I didn't actually know what a link worker was or what it involved. If there was a time span, you could only see them for so long. So I was apprehensive in that side, but once I'd made the initial introduction, then I found that I clicked with the person, so it's made the transition a lot easier.
I was referred to Deb from my doctor because of my depression, and I needed help with my dual being stopped, and help with trying to get a council flat, which is sorting out. Getting a flat, and I'm getting there now, and I'm hopefully moving in shortly, you know, in the next couple of days, hopefully moving in.
I got in touch with the community link workers through the doctor's receptionist. I was having problems with my son's benefits, and the community link worker came to the house. She made us feel really comfortable. I explained my story to her, and she headed us in the right direction to the Citizens Advice, who helped us get me appeal through, and we won the appeal. But without the help of the community link work, I don't think I would have done it. They're ideal to talk to, they listen to you, get in touch with them so easily, and I would recommend it to anybody.
So having no referral criteria for the community linking project is really helpful, because it means that we can send in any people that we think might be suitable for the service, and there's no sort of exclusion criteria.
The partnership between Edberts House and the GPs is a really significant part of the model that we've developed. So our community workers have really strong community development experience. They're used to working with folk who have complex social needs, and the blend of that expertise and the GP's medical knowledge makes a really powerful partnership.
The benefit of us working with Edberts House was their expertise and knowledge around the social prescribing agenda. They're very passionate and driven.
The community linking projects definitely changed our approach to patient care. We now have a much more holistic approach to patient care, much more complete. So if a patient comes to us and the main problem to them is that they can't eat properly and it's affecting their diabetes because they're so busy visiting their elderly relative or caring for their elderly relative, then we can maybe help them in that way, get them some support, which can then help them to look after themselves a little bit better.
I'm able to read the patient's history to find out what's going on with them, and then after I see a patient, I'm able to use our assessment and to to give a full and complete assessment of the patient so that obviously everybody that's in the practice is able to read that.
I was very depressed and isolated, and I found it hard to make friends or find somewhere for myself to go. And that's why I asked Moira. I was referred from the doctors to Moira to help find somewhere for me to go to.
Medicines are not the whole answer to patients' problems. There's a lot of social deprivation in the Felling area, so there are lots of practical things that the Community Linking Project can address, which medicines don't always have a role to play.
If I tried going to the appointments that I had, they would have just bamboozled us with big words and all that, and I didn't understand what half the things I seen. But Edberts told me help. She was there and she answered the questions I couldn't answer, you know. The system's all wrong for people who cannot understand what's going on, you know. And with the care like Edberts, it's good.
I was finding it hard to get out of bed in the morning, and I was frightened of doing anything myself.
My panic is going to somewhere new, whole parking situation, whole meeting new people.
A lot of patients lack the confidence to go places by themselves. That can be really scary for people, and often just kind of handing a leaflet, it's not enough. There needs to be that shoulder-to-shoulder support where we will go with patients to appointments. We will listen to what's been said, and then we can come away, we can sit down with the patients and we can talk through what the next steps are.
And I know that some clients have went away and then they've been able to talk to the community link worker afterwards and go through what was said in the appointment and just sort of firm up the sort of advice that we've given.
Difficulty having accessing services, the dual gas, like any council, I just kind of did. I can't afford the phones and travelling, and I can't use a phone. I've struggled with filling forms in. I mean, it's hard, you know. Deb does all that for us, and it's amazing. I just can't explain it.
I think there's a huge need for the Community Linking Project. It provides sort of everyday support and emotional support to patients. There's so many social issues within Gateshead because it's such a, there's a lot of poverty within the area.
When people have really quite complex needs, then expecting them to be resolved in 10 or 12 weeks is quite unrealistic.
We've been collecting data across our 4 practices over the past 12 months, and now we can evidence actually that patients who are accessing our service have reduced their GP visits by on average 24%. Now this is freeing up valuable GP time. So far 523 10-minute GP appointments with a potential saving of approximately £18,000. However, as many non-medical GP appointments often go on for more than 10 minutes, often for 20 minutes because they're quite complex stuff that's being discussed, we estimate that this cost saving is more likely to be in the region of £27,000 to £30,000 a year. So our long-term support in the community is something that is both cost effective and changes lives.
I feel that it's really important that we come from a community background because I think people from the community, we think slightly different. We don't think in a medical model. We don't think what's wrong with the person. We think what can we do to make this person's life better. And we're able to use the links that we have with both the statutory organisations and the third sector organisations, and we work in partnership with people.
As workers, we're really embedded in the surgery. We attend the staff team meetings, and that allows us to feed back to the GPs maybe what support and what work we've done with patients, and it allows the GPs to get a really good idea about what social prescribing is and how that can best help patients, and it also demonstrates the impact of the work in the surgery.
With the depth of knowledge and experience that Debs and Moira have as the community link workers, this has had a positive impact on the community and for those patients, leading to less appointments being needed, which of course is a benefit to practices and patients.
It wasn't for the community work that when my head is, my brain is, I honestly don't know where I'd be now. I had a bad Christmas, blood clot in my lung, 2 hours is deed, nerves was down in my feet. With the depression, I think I would have been, I don't know if I would have lasted.
Community link workers are on the ground in that respect. They're seeing those issues in the surgeries when patients are coming in, and they can pick those up and pass them on to more specialist services such as Citizens Advice, who can provide advice in more complex areas, and a sort of it gives an all-around sort of package to the client to better support them.
If there was no more funding for this project, it would be an absolute travesty, to be honest. It's absolutely brilliant. It's one of the best things that's happened in latter years that I know of. It's made a huge difference to everybody. It's made a huge difference to the patients, huge difference to the clinicians and the staff.
Genuinely, I think it's absolutely invaluable. I can't see that we would be able to really cope effectively, and the NHS nowadays is about working holistically and more effectively together.
It's taken me this time a year to be referred to a psychotherapist. I was meant to be seeing a CPN. CPN decided that I should see talking therapies. Talking therapies decided I was too bad for them, like too severe or too many problems, I don't know what the exact terminology. So they then referred me to the psychotherapist, and then it's a year's wait at least to see a psychotherapist. And then you can only see them for 6 weeks. And then you've got to go back in the system of waiting for them to decide what you get referred to.
Pulling together and working effectively in trusted partnerships, we can start to really see people's whole picture. Not just their housing over here and their education over here, but actually bringing those things together, and that in that way we're really able to help the whole person. And in the end, I believe that that approach will be what tackles some of the greatest health inequalities in our country.